Thanks. We've got more coverage tonight about those nursing homes here across our state. The data on COVID-19 cases is vital to these Indiana families trying to make health care decisions. Some nursing homes still don't want that data publicly released. Tonight, our senior investigative reporter Bob Siegel talks with a local family who told him that lack of transparency was deadly.
He gave me 2 thumbs up. I had my phone out so I could take a picture of it.
This was Daw Hubbard less than 2 weeks ago, shortly after he was diagnosed with COVID-19 inside a nursing home. His daughter Barbara says within days, her father got much worse.
He was really, really bad, and he was in pain. He was suffering. That day, his temperature had went up to 106.
To Barb's surprise, the nursing home did not send her 91-year-old father to a nearby hospital.
The doctor examined my dad and said he was doing fine. He just had a fever.
Barb and her family trusted Greenwood Meadows to take good care of her father, even when the nursing home would not tell her how many other residents had been diagnosed with coronavirus. You asked how many cases they had there.
Yeah, they tried to tell my sister they couldn't tell her. Like that was confidential or something.
Barb had no idea COVID-19 was running rampant through her father's nursing home. More than 100 seniors infected, more than a dozen dead. All she could do was watch from a distance outside room 117. Eventually, Mr. Hubbard was taken to a hospital, but not because the nursing home sent him there. His children called an ambulance on their own and demanded he be transported to a hospital where he died 2 days later.
It is so heart-wrenching to be outside of a window and can't do anything to help the person you love, and you just stand there and watch him die in front of your eyes, and nobody won't listen to you. They could have warned all of us so we could have did something about our family and removed them before it got so bad, and they should have let us know how many people had it.
State guidelines now say that's exactly what nursing homes should be doing. But even after those guidelines were released last week, Greenwood Meadows management still did not share that with Barb's family. 13 Investigates has also repeatedly tried to get COVID-19 information about what's going on inside Greenwood Meadows, both from the management company and from the state health department. Both refuse to release that information publicly. What makes that so interesting is who owns this nursing home. You do. While the public owns this facility, the public isn't allowed to know what's going on inside. Greenwood Meadows is one of dozens of long-term care facilities owned by the Health and Hospital Corporation of Marion County. The county-owned public agency collects millions and millions of public tax dollars, but did not comment for this story. Instead, its management company, American Senior Communities, told 13 Investigates it is now adhering to state guidelines. A spokeswoman told 13 News, "We send daily communications to residents' designated representatives, informing them of the total number of COVID-19 cases and new cases in the last 24 hours. But Daw Hubbard's family says that was not their experience.
My dad could be alive right now if they had only provided that information sooner so we could have done something to take him out of that place.
13 Investigates is continuing to fight to get you COVID-19 information for all nursing homes in Indiana. If you have a loved one in a nursing home and they won't release the information to you, you can file a complaint. We've got information on how to do that at WTHR.com.